I'm Kim Fallon from the New Hampshire Medical Examiner's Office, and I'm going to be talking about drug overdose deaths in New Hampshire. In the 1990s, we had about 40 to 50 drug overdose deaths a year, and that number started to tick up in 2000, and it's been steadily increasing. Last year, we had 193 drug deaths. Out of those 193 drug deaths, 70 were from heroin. The year before, we had 164 drug deaths, and 38 were from heroin. So far this year, and this is as of May 19th, we've had 67 drug overdose deaths. 20 of those have been from heroin, but we have over 50 cases that are still pending. We're waiting to get the toxicology results back, and we suspect that quite a few of those are probably due to drugs. This graph categorizes the drug overdose deaths by age, and the tallest column, it's the tall purple column, those are the 41 to 50-year-olds. There's an orange column next to it, and that number's been increasing steadily. Those are the 51 to 60-year-olds. So we do have a lot of people that are using drugs recreationally, usually in their 20s and 30s, and even some teenagers, but most of our drug deaths are in that 40 to 60-year-old age category. And a lot of those people started off taking prescription drugs for legitimate pain conditions. They were taking painkillers, and then they became addicted. And sometimes their prescriptions get cut off because their pain situation is resolved, or they've been found to be misusing their drugs. So at that point, they're addicted, and they end up turning to other drugs, including heroin. So most of our drug deaths are in that age category, 40 to 60 years old. For our medical examiner cases, most of our cases are male, and that also is true of our drug deaths. Most of our drug deaths are males, and last year we had over twice as many males dying from drug overdoses than females. The manners of death are natural, accident, suicide, homicide, and undetermined. So drug overdose deaths are not natural. Most of our drug deaths are accidents. About 15% fall into the suicide category, and if there's no clear evidence either way, whether or not it's a drug overdose death from suicide attempt or a suicide, or a drug overdose because somebody was using drugs recreationally, our doctors do have the option of putting undetermined as the manner of death. And so we have a few drug deaths every year where we know the cause of death, it's from a drug overdose, but we're not clear on what the intent was. So in those cases, manner is undetermined. The red line in this graph indicates the opioid deaths, except for methadone and oxycodone. And what's driving that red line the past few years has been heroin. The green line is oxycodone. The thick blue line is methadone. Purple is cocaine. We have about 20 to 30 cocaine deaths a year. And the benzodiazepines, that's the light blue line. And those drugs are tranquilizers such as Valium and clonazepam. We do have drug deaths where benzodiazepines contribute to the death, but usually it's in combination with other drugs. This graph shows you how much heroin deaths have skyrocketed in the past few years. In the 90s, we had 0 to 5 heroin overdose deaths a year. And just the past couple years, it's been increasing dramatically, including last year where we had our most ever, which was 70 heroin deaths. The drugs that contribute to the death are listed on the death certificate, and when you query the death certificates, these are the top 5 drugs. Heroin is by far among the highest with the 70 drug deaths. Oxycodone, we had about 40 last year. Fentanyl and methadone are also opioids, so 4 out of 5 of these drugs are opioids. Cocaine is the only one that's not. And we look at drug deaths and also whether or not somebody just has one drug in their system or if they have a combination of drugs in their system. For single agent deaths, it's been pretty steady. We've had about 40% every year. It's around 40% where somebody just dies from one drug. And when we look at what that single agent is, the past 3 years, again, it's been heroin that's at the top of the list. The other drugs, methadone, fentanyl, and oxycodone, are also opiates. Cocaine is the only one that's not. We still have cocaine deaths, but by far, most of them are opiates, and most of those are heroin. We try to find out where somebody got the drugs that they died from. In this table, prescribed means that the person who died, they died from taking their own prescription, from misusing it or abusing it. Illicit drugs include all of the illegal drugs like methamphetamine, cocaine, and heroin, but also prescription drugs when the person who died, it was not their prescription. They were taking somebody else's prescription drugs. So for a few years, most of our drug deaths were due to prescription drugs, but that now has turned around and it's illicit drugs that are at the top of our drug death list. And most of those illicit drugs, again, are due to heroin. We have people that die from taking a combination of drugs, illicit and prescription, over-the-counter and prescription, over-the-counter and illicit, or all three. And we also have a few deaths from over-the-counter drugs every year, and most of those are due to suicide. New Hampshire used to be one of 15 states in the country that had more drug deaths than traffic deaths, and it wasn't because the traffic deaths were going down, it was because the drug deaths were increasing so much. But unfortunately, that's not the case anymore. We're not one of 15 states. That's really the norm around the country. All other jurisdictions are seeing, not all, but most other jurisdictions are seeing the same thing, where they're having increasing drug deaths, and those drug deaths are outnumbering the traffic deaths. So that's the New Hampshire drug death data for the past few years, and here's my contact information if you had any questions. Thank you.